You're traveling all the way from Georgia to come see me. Okay, so I better get this straight.
Yeah.
What happened from last time? How do you feel? What changed?
I do feel better. I still have nagging pain when I work around here underneath my scapula.
You're probably looking down and it's just filling up with fluid. And then the fluid presses on the nerves and then it causes you pain. All right. She's got mostly just, I'm kind of surprised you have swelling on this side when you say it's the left. Is it?
Mm-hmm.
So I'm like, nope, it's all the way down here on the right.
It's all
Because it's been a week. Yeah. It's time.
Yeah.
It's time for another one. Especially when you got to get a few under the belt. Oh, there you go. Good.
Like I was really stressed out. I stress out about everything. So I don't know
I
if
do too.
stress plays a part in
can.
making your body hurt.
Oh, yeah. You can just pull those subluxations right out. Just with your thoughts and your mind. I've seen people like start to talk about a touchy or a sensitive issue and their backs just cramp right where I'm pushing.
You're like, let's stop talking.
Right here at the base of your neck. I cleared out the top part.
Mm-hmm.
There's like this lump here, but that's pretty much gone. Right there is where I'm like, and you're a female, and I can't believe how much pressure you can take. That's just how swollen everybody is, you know?
Right there. I get a lot of headaches where you were at.
Where I'm pushing. Do you feel that radiate up into your eyeball?
Mm-hmm.
These epicranial nerves right here can be the source of headaches. Right here. We call them cervicogenic headaches, stemming from the neck, cervicogenic, genesis. You have to be real careful with these and take it one step at a time.
Where's it at?
Like these deep
Somewhere
cervical ones.
around in here. Usually somewhere around in there. I thought maybe it's not even that.
Okay, bounce, 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 bounce. These joints right up here in the atlas, they like to be wiggled. Ooh, that's where it's stuck. This is where we need to get the range of motion back. In the upper neck. Wiggle, wiggle, wiggle. Is it too much? You gotta let me know.
Oh, no, I'm good.
All right, here we go. This needs it here, right atlas. Right here. Perfect. Right here. Okay, just making sure the whole thing went. You okay?
Mm-hmm.
Right here. Right here. Whew.
Yeah.
That moved. Okay, now we go back and check it. Did you hear that out there? Jeez. Now I can do this one. Okay. Baby toe, it went. It just didn't give me a pop. It's always the baby one. It's like, wee. Your first two toes don't want to move.
They don't.
No. I'm not going to yank on them. Yay. Ooh, tight over here. My God. That was a whole flick. Mm-hmm. All right. And this one, yep, it moves very easily. Okay. I'm starting to see a pattern. Knee. Okay, good. This side. Good, okay. on your stomach for me.
Yesterday, I woke up with my shoulders feeling funky.
This is going to be a lot of work. Let's go. Let's get started. Here we go. There's one. Okay, and that's. Oh, no, I spoke too soon. There it was. You did good. Let's see if we can't fix it then. It's definitely tight. Deep breath in. All the way up. Perfect. I gotta go right here on this joint. It's probably not gonna pop. I just need to check it. That was the last one.
It feels like it needs to pop.
This one does still?
Well,
when I push
and
on
that's
it?
how I normally feel. Like somewhere around in here, it just feels there's like a stiffness. Mm-hmm.
When I go, oh my God, you're right. How much more is it gonna go? It's just like going. Okay, now let's see if we can get. It's like right there. That's all I can go. That's all. That's it.
Okay.
Maybe later. I feel it moving.
Yeah.
Okay, green roller. I can feel it. Here we go again. I still feel right-sided over here. I know you're saying the whole left.
Yeah.
I think we discussed this last time. I'm like, wait, I remember this conversation. This is where I feel right here it starts. Right there. Ugh. So what I'm feeling is her spine is pushing back up against this roller here. And, it sinks easy here. Flexibility's here. Flexibility here. And that right here is where it really just pushes up against me.
It's very stiff.
That foam roller will help. Fighting with your spine.
It cracked a little bit.
Yep, there we go. I wouldn't do it if I didn't think you could handle it. Okay.
I am good.
Okay, one by one. Push on them. Go up to the next one. Break up those adhesions. This is from sitting all day. Sitting just really pops out the thoracic spine.
I actually get, like, between sitting, I do sit, but then going back and forth with x-rays and everything, too. Mm-hmm. I think I've been trying to watch, like, how I'm kicking off with my knee, too, because when I go walk out to take push the x-ray button, I'm using my left leg a lot and turning, like, twisting, because my knee was fine, and then towards the end of the week, I started to have my knee problem again. But a lot of patients too, and I don't know why, but they're like, ooh, that's too far back, you need to sit me up. And by the time I sit them up, they're practically back up. And I'm like, yeah, so I can screw my back up today, thanks. That's
right, because you need them laying down so that
it's already bad enough how I'm having to sit, and then...
Because then you're going to have to, like, look to the side.
And then totally turn my body.
Oh my God.
To the right.
How do you do it?
But I'm passive aggressive. I don't argue with patients a lot, so I suffer instead.
Oh. Here's another oof the moment. You're like, I don't feel a thing. Or do you feel it?
That feels good.
Oh.
I've been begging him to do that this week.
Oh yeah, get under that scapula. And then we're gonna do the elbow. You see them. I just want to show people how the muscles move, when you do this. Bring that down. me check it again. There's still that little knot there, right on the outside. I have a feeling this side's going to be more scarred up. There, it's starting to go. There it is. I'm going to hold it. Arm down. Let me just bring that around. Get it like that. And your back is bright red. The side isn't as bad over here though. So I'm starting to think, well, maybe it's into your lats. Yeah. This is the side you have the pain. You're ticklish. I'm sorry.
Oh no! I was just laughing. No.
You were like,
oh yeah.
It's this right here. So I have to put together the pieces of the puzzle and figure out why the heck this is going on. So I believe that this is the source of it right here, of the part that's wrapping around. It's stemming from this rib, and this rib.
Mm-hmm.
If I were to follow
like
it,
a rib, yeah. Because we were always wondering if a rib was out of place, but
yeah, it goes. Is that right where it's hurting you?
Yeah, because half the time it extends even underneath my chest. If it's that bad of a day.
Right. So there's a nerve ending here, and then there's a nerve ending on the front. So it'll feel like something's slicing you.
Mm-hmm.
Right there. Here we go. 1, 2, 3, 4. Give you a break. And again. Come on. Wow. That is just something. It's not every day you see this.
That feels so special.
It's just in an odd location. And it has to be the way you work. It's not a normal job.
Between that and photography.
And the photography, that's right.
I like have 2 seconds.
Well, in this day and age, you have to have multiple jobs. How is the photography going?
It's good. The weddings are starting to pick up.
Ah.
We're gonna start getting busy. You know, we have a lot of people that come into town now to St. Simon's and Jekyll to stay. So I get a lot of out of town people.
That's good. Is June a popular month?
Mm-hmm.
Or is that just a saying?
It is.
June bride. Is it really like maybe because everybody gets off of school?
It's so hot.
It's like tapping out on me. It's getting this little it gets like a little bit of swelling right here, and then so that's about all I can do. That nerve is not very deep here. So that's why you have to know where all the nerves are. It's really a hard thing, and that's why you won't see anybody. You won't really see a massage therapist per se do this unless they've had the training to know where the nerves are. The nerve is very superficial here, because that's right as it exits behind the scapula, right here. You know, the scapula is like this little pizza wedge right here, and so underneath it, I can't get to the nerve there. Oh my God, I did my job. Let's just put it that way. I think that's what she came for.
Yeah.
Right there. Like, okay, moving on. Next spot. We don't feel half of what's going on in our backs. The muscles are created to withstand a lot of pressure before they complain.
Yeah.
Now, you can handle this?
Mm-hmm.
She ain't no wimp, that's for sure. You okay? Breathe. No, I'm feeling it now. I'm starting to understand what's going on. It's very fascinating. Ooh, there it is again. Just putting pressure. Nope, that's definitely it. This is definitely it. I just gotta give it a break. Maybe going down. Okay, yes, finally. I did it.
I've been trying to sit up straight while I'm cleaning, and I guess it's better to have a bend in the lower back, because I think I've been noticing when I sit, I end up forming the complete opposite.
You slouch when you
curve.
curve?
Yeah, so my lower back feels that.
That's why I tell people to foam roller, because it'll be easier if you bend backwards.
Mm-hmm.
If you take the time to bend backwards, you gotta retrain your body. Retrain your spine. You okay?
Yep.
It's
just every time you think one certain part of your body hurts more than the other, like the other side surprises you. Yeah.
Well, it hurts over there too. I don't know.
It's a good hurt. I'm weird.
No, I think pretty much anybody that comes into this office knows that what they're gonna get, to expect it. It's like, yeah, you're gonna feel discomfort just for a little bit, but then as it relaxes, it eases up on you. This is what it looks like about 20 minutes afterwards. See, all the redness is gone, and she's just left with this petechiae. And this is where I believe her pain is stemming from, are these rib heads here that wrap around to the front. She's saying she feels pain that wraps around underneath her arm to the front of her chest. And I mean, you can just see it. Some stiffness from maybe walking or something, but there's nothing over here.
And I always walk super fast.
Yeah, you just got some calf, just tightness, but nothing. And then we go here. I don't know if she can handle it again, but oh man. So I think you're right. This is a sciatica issue. You don't feel it here, but the nerve is here. The same nerve that's here is here, and there's some irritation in that nerve. So I'm glad you're coming in now, and you're not waiting until the last moment to come in. Clear that out. Clean it out. There we go. Oh, that was pretty rough. Here we go. TFO. Feels a bit. Not. Ugh. Right here, she's got a knot. Beat it up. All right, then roll yourself back a little bit. If I can get down the side of the leg. Now roll yourself back.
Whoa.
Are you okay? Head's okay?
Is it okay to
Yeah.
head off?
Yeah, I'd rather you have it that way and not give you a
I
whiplash.
gotcha.
Here we go. Bottom leg straight, top leg bent. There's. Was that you or me?
Take much off. That was me.
Here we go. Head back. There we go. Perfect. Now let me check the knee. She's having pain right here, right? I mean, I feel the swelling right here.
I'm super excited about this part.
That'll be nice. Oh, man.
It's okay. I'm good. I just remembered how it felt last time.
I'm trying to be nice, but I still got to get through that.
It's not so bad.
We'll eventually go. I don't know if you could see. I'm struggling just to stay on top of it, so that I can get into the belly of it, and squish it down.
That's it. I give that my whole head.
Yeah, it will radiate up into here. And then it should stop as soon as I come off. Again, the nerve is real deep in here. It's really deep. So I'm not right on it, but I am influencing it. This side isn't as bad. Oh, it's jumping though. You know, you have to make a judgment call that when it gets hot like that and red, that's it. You know, I can still keep on working on it, but nothing's going to change. Ugh, God. Jeez, head down for me. That's all I'm gonna do. What does it feel like? Feels alright?
Oh yeah.
No, hardly anything over here. Oh, here it comes. I don't know. I was just wondering how it's feeling.
It does okay.
Like, does it feel like it's, like, just take it for a spin? Yeah. There you go.
That's fine.
Okay. What you do is hands on your hips for me. Okay, and then what you're gonna do is you're gonna press your elbow into my elbow right here. There you go. That's all I need. You know, this is just, this redness here was what she did have here. This is what it'll look like in a few minutes. This calms down. That's what we're doing. We're bringing blood flow. People ask all the time, what is this? Bringing in blood flow, bringing in circulation to that top layer of tissue. And, I don't know, it should feel good. It should feel like we're pushing back some blood flow here. And then we're a little careful. I don't have to.
I know that they pop a lot. My wrists pop a lot.
Yeah, they feel real loose. So that's why you're not seeing me body slam it. Yeah, some people's wrists are real loose, and some people's wrists are just, stuck. You know, yours don't have that. Let me see how that just clicks. I don't need to work real hard on that.